Hi, so I'm Jeanette Stingone. I'm from Columbia University. Do you want to introduce yourself, George, quick, and then I'll...
Yeah, hi. My name is Gkoutos. I'm from the University of Birmingham in the UK.
So we're going to introduce our panel. We're going to let our panelists introduce themselves in a minute and give you just a little bit perspective of where they're coming from. But just a quick audience poll, non-digital, hands up. Who is a trained ethicist in the audience? None of you. Oh, we had one. We have one here too. Don't worry, I'm not either, right? But how many of us have taken ethics training as part of our scientific training? Right? How many of us in our own work consider the psychosocial impact, the impacts on our communities? How many of us live in communities that are impacted by science? So I think you can see that we all know more about this topic than we think. And so now we're going to go to our panelists. We're going to allow them to introduce themselves and just give very briefly, we're going to ask them questions in a minute, but just like a one sentence or even one topic, what is the one thing you want to make sure we discuss during this panel because you think it really is top importance? So we'll start with Agis, if that's okay.
Hello, I'm Agis Tsouros. I come from Greece originally, and perhaps the most relevant experience I have in the context of the meeting is the fact that I have worked for 30 years for WHO, and my job was really to try to convert scientific knowledge into policy. And what happens then, and what are the obstacles, what are the enablers, and why it is today perhaps more difficult than ever to implement some of these great ideas, just to keep you wondering. Thank you.
Thanks, Caspar.
Thanks. So my name is Caspar, Safarlou. I'm from the Netherlands. I recently finished my PhD on the ethical aspects of exposome research. Part of that was mapping the ethical aspects, but part of it was also writing more normatively about what are the good values for exposome research. And that's really a topic that I'd like to have on the table, which is what are we here coming all together for? It's exposome research. It's about improving our understanding of environmental determinants of health by mapping more and more exposures and being discovery-driven, discovering new exposures and perhaps also generating new hypotheses. And I think this is, let's say, the core focus. Oftentimes we talk in ethics about inclusion, but what I think is also important is to talk about where are value conflicts, where do we think there are different values that we pursue, where do we think that, for instance, participants are interested in different values. One issue that was mentioned was actionability. If we communicate findings to participants, are we thinking of just communicating those which are actionable for their health, or also perhaps for other values that they might have, for instance, family planning, if it's an issue of fertility, for instance. But at the same time, there's also issues of policy, of course. So we might also have different values on how exposome research might be used for policy. And this is, I think, also important to have on the table.
Great. Awesome. And now Jinkook.
Hi, I'm Jinkook. I'm a professor of economics at University of Southern California, and one of the MPIs of Gateway Exposome Coordinating Center. I'd like to bring attention to a broader perspective to the exposome is really commendable, considering that exposome not only includes the chemical and physical exposures, but also it is really presenting the framework for us to think about social, economic, and psychological exposures and experiences that people experiences. So today I'd like to draw your attention that how policies would shape the physical, social, and economic environment that we as an individual live, work, and age. And this is a great platform for us to think about not only on impact on social policy and community environment, but also how those policies and social and economic our to this environment we are living in. Thank you.
Thank you very much. And I guess many of us are working around human health, and having Agis here today makes a lot of sense. We can reflect how his thoughts are. How does exposome influence both the values as well as the approaches in how we develop and apply public health practice today?
You know, in my work as a director of policy and governance in the European Office of WHO, the job was to try to mainstream and integrate concepts such as the social determinants of health, the whole range of the determinants of health, ethics, inequalities in health, in the work of everybody. One of the things that I learned very early in WHO is this: how come it has taken us 50 years from the time we knew that tobacco causes cancer to develop the Framework Convention for Tobacco Control in 2005 or 6? How come we haven't made any significant progress on addressing inequalities in health, although the strong evidence that appeared was already there in the early 80s, and we are in 2025? How come there is very little action, and mainly at the local level, on the social determinants of health, and I mean by that economic, cultural, commercial, political, and so on, determinants of health, when the first evidence appeared in the early 2000s? So I always wonder what it is that, on the one hand, enthuses the scientific communities, and on the other hand, it faces an incredible resistance.
Just put the microphone closer.
An incredible resistance, mainly within the political context. I would like to use a metaphor for that. I have felt very often that it is as if we were trying to implement software that we developed in 2025 on a computer that was built in 1995. It's true. Because one of the big issues is governance. One of the big issues in public health is that you need a whole of government and whole of society approach. We talk about intersectoral action for years on end, but very little we are doing. Even our own organizations are vertical. We don't know how to work horizontally. So this is what I would like to bring to you. This context, which has become even more complex today for two other reasons. Second reason is the fact that today we live in a world which is much more uncertain. The pandemic, climate change threats have made us realize how vulnerable we are. And then there is a positive side to all this, that we have become in recent years more familiar with key concepts for exposome, like the life course approach, what it is to understand that exposures are accumulated over the course of life. We have become much more familiar with terms like upstream and downstream action. And in fact, what the exposome is doing is right in the middle. Many people thought that talking about social policies and so on was too far away upstream for public health practitioners to engage the politicians. So here we come with the exposome, which allows us also to measure, to have data that can show hard evidence that we can make a difference.
So I'm just going to move on to the second question, and then we can come back
And
to
the last
discussing some-
point I want to bring as the third dimension to this is that this development now is bringing back to the fore the big question of social responsibility versus personal responsibility.
I'm glad you kept talking, because that is an excellent segue to our next question for the ethicist in the room, right? So this idea of balancing benefits to the individual and the idea of individualism with the ideas of egalitarian justice and acting towards the community. So I was hoping you could talk a little bit about how do we balance that in the exposome? Do we balance it? What do we do?
Thanks. So I think a big part of getting to an answer to that question revolves around what the values of exposome research are as a specific delimited community that wants to achieve a particular mission. And in that respect, exposome research also excludes things, excludes certain projects. I don't think exposome research can solve alone the big challenges of the world, so to say. So we should be specific and purpose-driven and mission-driven in that respect. And this is where I think that the definitions of the field and the exposome can really help us specify what type of scientific and technological progress we'd like to make. And in that respect, I think that it's also important to bring this idea of value conflicts again on the table. And here, I think there's also a way of explaining partially, not fully indeed, the conflict or the problem of why there hasn't been much more direct public health action when it comes to things like smoking. Indeed, many people really, really, really value smoking. They love smoking. It's really hard for them to quit. Companies make a lot of profit selling tobacco. There's all sorts of different value conflicts here, and we might reasonably disagree about the extent to which these value conflicts are relevant for exposome research. Like, there's this question of what policy action would exposome research support? And if our mission, let's say, the mission of exposome research as a research program is establishing this comprehensive and discovery-driven approach to the environmental determinants of human health, I think that leaves open many of the more political values, like whether we should strive for egalitarian conceptions of the just society, or a particular political vision about what the government should do. And I think I disagree with the idea of egalitarian justice. I think that we should strive each as an individual for our own well-being. And what we need to safeguard that well-being are certain rights: life, liberty, property, the pursuit of happiness. So I think that the government should primarily protect these rights, and as a corollary, the pursuit of health, but not necessarily the achievement of health. Now, naturally, there's also questions concerning when does pollution impact your property rights. But at the same time, there's, I think, a different view of what the responsibility of the community, let's say, is there, as opposed to what individuals should do and how individuals should come together as a group in order to advocate, for instance, for more healthy cities, or make sure that certain other benefits occur to people when it comes to their health.
That's great, Caspar. Thank you. And based on that, I'd like to go to you, Jinkook, and hopefully with your background in finance and economics, I was wondering if you can take us through as to how the policies develop around the environments, the physical ones, the social, the economic ones, where we live and age, some of us hopefully to 150. How these policies shape those environments, and how exposome can be part of these efforts?
Thank you. Thank you for the opportunity for me to share my thoughts. So first of all, if we can think about how policies influence our health or various key risk or resilient factors of the health, we can think about it both directly and indirectly. So in terms of direct influences, you can think about the policies that determines our access to healthy diets or the tobacco consumption. You hear a lot about the tobacco taxes that influences the pricing decision of tobacco will actually influence people's consumption patterns. You can also think about various policies that creating the injury prevention or providing the buildings that enable for people with a disability to live in or move around more easily. There are a lot of those direct policies one can think about influencing our healthy diets, various regulation or potential regulations in terms of preventing certain contaminations or even the food packagings that influence our daily life. And there are also various indirect policies that influence the health. And some of those more obvious examples would be the transportation and urban design and the regulations that put on, like even the production of automobiles and where to put the factories. And all those factors influence how the creation of pollution or the impact of those pollution reaching to our everyday lives. And that also has not to mention various healthcare sectors that determines the access to healthcare and the costs associated with utilizing those healthcares. I think it's also important to think about how policies influence our life course. So that shapes our exposures during our early childhood when we were growing up, how we are exposed to various air, but also like the playground and how to get to schools and so forth. And those kind of environmental exposures are shaped by the policies. And these policies influence our development throughout our early life and our later lives. And if you start thinking about it, not only like countries where we live in the US, we see a lot of variations across different states, even within the states, depending on whether individuals are living in the urban area or rural area, or even the zip code of the neighborhood and the environment varies quite a bit. And such variation actually provides us to leverage to looking into how various factors or dimensions of exposome influence our behavior or health outcomes. That actually provides the opportunity to do the research. And I think it will be important for us to think about taking advantage of those policy reforms within the states that will enable us to tease out the impact at the environmental level while accounting or holding for individual level variations.
Great, thank you so much. We've heard a little bit about what our panelists think is important, and now we want to hear what you think is important as well. So we're going to put up the Menti board. So we're not going to do the Menti board. Instead, that's okay. We're going to go to some questions that George and I thought were important, and hopefully you all agree.
It's fine, yeah.
So,
Yep.
You want me to?
So one thing, So one thing that we heard today, and I think it's vital. It's a make or break for this effort we all are interested in putting together, is the concept of trust. Trust both in terms of how we trust across organizations. We heard Peggy today raising questions as to how we're going to trust each other to share our data, share our outcomes, and so on. But also trust amongst the public. We heard Sir Jeremy raising the issue of how we involve patients, and certainly some within the UK that are very, very interested and keen around involving patients and public in their efforts. So I was wondering, how do you see this shaping our efforts? And this is open to all of you, but I guess I will start for the public health with Agis, which is more into patients.
Well, trust, and I'm glad was mentioned by everybody. And the key issue is to involve the stakeholders and especially the community from the start. This is very important. It's called democratic governance. It is called empowerment. You engage them in the decision-making processes, in designing a local project, in identifying priorities. It has a strategic significance to do that, and this kind of ownership building is also the flip side of trust building. And to me, it is essential. On the other hand, what we need to do is to find ways to communicate to the wider public. And for this, we need journalists and communicators, the essence of what we are trying to do. We all experienced that in today's world, and it happened during the pandemic, what it is to be faced with fake news, with conspiracy theories, with distorted facts. You can imagine now, if you want to tell people that they are facing risks, that they can perhaps do something about them, how to manage those, and we need to find the right words to share this information with the wider audiences.
Before we open up to the rest of the panel, I just want to start to invite the audience. If you have questions, if you have topics that you think are important for people to consider before the breakout session tomorrow, please come down and we'll let the other panelists talk, and then we'll go to audience questions. Oh, and we can also, we're going to multitask like you've never seen, and we're also going to do the Menti board as well while we go up. So you can sort of vote on what topics you think are important. And so, sorry, Caspar, I don't want to interrupt. I think you wanted to say something in response. So.
Oh yeah, I wanted to add something indeed about building trust and communicating results to participants. I think again it's important to be sensitive to this issue of trade-offs. So even if some information about your exposures might not be actionable for your health, it might still be informative just to satisfy participants' curiosity. Curiosity is a value to them. There might be other values, like I mentioned before, with fertility, which is perhaps a bit of a big impact. But at the same time, also communicating exposures can be fine if you don't know what their effects are. And saying that you don't yet know is a way of respecting the autonomy and agency of participants. And research has shown, at least the research that I've encountered in the review I wrote about ethics of exposome research, that this is fine. Participants don't necessarily experience any anxiety about the exposures that they have, which you might expect if you can give them a good explanation that you don't have the knowledge yet and it's unknown what the impacts are necessarily.
Great, thank you. So you can see we have a horse race going on the Menti board, but it looks like trust that we've been talking about is also resonating with all of you as well. So we could go to the audience for some questions, and go ahead, Ozzy.
Hi, Ozzy Lozoya again. So I have a question, particularly with the ethics aspect of it. And I think for me, the whole thing is there's only so much you can do in creating science and insight, but there's also the question of personal responsibility, as it was brought up, and personal agency. So we are a privileged group of people that are discussing this. This is to impact many other folks around the globe, really. For people that are in this moonshot, what is the extent of our social contract? Like, how far can we push the sharing of evidence or the scientific literacy and then have a level of essentially surrendering control for democratic systems to make choices on what to do or not with the evidence.
Whoever wants to jump in.
So I don't think there is such a thing as a social contract. I'm not a social contract theorist. That said, a lot of research that we do is funded by governments, and we can have a discussion about whether the government should fund research, but taken that it does, there are definitely responsibilities there as to making sure that you're transparent as to what you can achieve and what you can do. And especially given that there's an ambition for exposome research to be global, there also has to be a recognition of the direction that scientific progress will take. It will be there first in countries that have the means to do the research itself, and there needs to be a view with this global ambition to how this can be expanded. However, as someone who rejects the view of the idea of egalitarianism, I think that
See, we don't agree on this. I think we figured that out already.
I don't think that, I think this is a necessary a component of how progress happens. So I don't think that researchers should feel any guilt because of some idea of a universal moral obligation that they would have to impacting everybody in the world in the same way. There will be inequality there, but this inequality is a necessary feature of scientific progress. And in that respect, creating this inequality is good because it will lead to improved human well-being.
You look like you wanted to, yeah.
Yeah, no. Well, I think to talk about ethics and equity and trust is not just good for the soul, you know, to go to a meeting and just talk about these things. I know that the best way to be serious about those issues is to integrate them in the design of our studies. I mean, to know what it is to integrate the equity dimension, to know and be aware that there can be bias in the way we design our work. There are terms like colonization of research. We know what it is if we gather information only from one part of the world. So I would like to propose a term. During the 90s, when we had Agenda 21, we used to talk about health impact assessment. I would propose that we could equally have an exposome impact assessment, which means to actually scrutinize the design of our studies to whether they comply, they are in line or violate any of those ethical, equity, or other bias dimensions. But to do this seriously, because that's the only way, at least, that we can claim that our research is actually valid.
We'll go to the next question. Thank you.
Thank you so much, Rima Haber. And I will say Ozzy somewhat stole part of my question, but I need to ask it. What about the concept of agency? Like, the more we can model, predict, measure, all these things, you hear this a lot, especially more in the tech space now, but, you know, with current political environments. Like, if I can just tell you what it is, then you could choose what you want to do about it. What if you really can't do anything about it? How do you think about it?
So again, here, not being able to do anything about it depends on the person and the value. And I think that even if you aren't able to change, for instance, one of your health exposures, again, like I previously mentioned, this might be informative for you in some other way, might satisfy curiosity. It might help set research priorities in saying, well, this is an unactionable exposure. This is where we need to invest more research. So perhaps where your question is coming from is the extent to which when you can't do something, you can't be responsible for it. So in that sense, there's a real connection between responsibility and control. But maybe you'd like to say something more.
Like if you live in like a crazy polluted world with all these things around you, right? Like river parishes in Louisiana, right? We can give you all this information of all these things that are really harmful for you, but you can't, at the end of the day, it's not within your agency or power to do anything about it, you know? So what are we missing when we keep playing that argument, you know? And we can leave it for tomorrow too.
Also, like
Thank you.
Jinkook, or if someone else has a comment on this idea of agency and how do you intervene on that, it seems like that's the question.
Oh, I thought she was.
Or you can pass, too. We could go. You
I
want
can say something
continue?
short,
Yeah.
short about it. I think this is also an issue where we need to think about where other initiatives might help people to get more agency, and think about this as one of the limits that we should exclude from exposome research, where there are cases where it's really hard to give everyone involved in exposome research agency in all the relevant respects. Maybe we should connect them, for instance, to their physician as a researcher, and make sure that that's a pathway for them to get more agency. So we should also think there about what we're unable to do as something that we don't have any like responsibility to solve, but perhaps to put on the agenda for sure.
Seth Murray, Texas A&M University. I'm trying to rectify a tension in my mind of reaching the moonshot. So we heard a lot about a global initiative. The incentives in economics are all to scale everything. The incentives in biology are to discover universal truths that apply everywhere. But if we think about different people throughout the world, they live in different environments, they're exposed to different food, and there's a huge impact on population structure and genetic background effects, right? And then we talk about different ethical and political frameworks that these all have to exist in. So how do we rectify those tensions and have something that really does have a global reach, but local, direct impacts?
You will win $1 million if you answer this
Whoever gets
question
that.
correctly. Yeah, I'm teasing. That's absolutely not true.
I got you on that. If you don't mind. So what I'm seeing here, and coming from Los Angeles, we just had this huge fire exposure, and our whole community wants to know, is it safe? So I'm saying let's not just measure what's there, but have this actionable measure. What is a person's health status? Can we take this exposome, put it into an AI and have an output? The output we have to measure also and generate ourselves. What is the health status? How can we turn that into a single number? So if we have that, we have everything.
You can answer. Yeah. Let's do
no.
some conversation. Yeah.
Well, when we think about public health, we often forget the population perspective. And we often forget that this, first of all, it's not the business of just the Ministry of Health. If we want to translate exposome into real policy, you have to involve the Prime Minister, the whole government. I give you an example. Obesity in 2025 still becomes the basis for continuing with information campaigns to what is good or bad for your diet or physical activity. And yet, to solve the challenge of obesity in our society, you have to involve at least 8 ministries, where they sit around a table and they divide tasks, indicators, and accountability. It will never happen. So, just forgive me. I find it scary to be told that I was exposed somewhere in my community to an agent that may have an effect on the chances of my children developing cancer in 30 years. It's scary for me, this. But on the other hand, the exposome information can help policymakers, public health people, and other disciplines to build local communities which are truly more resilient, more resistant, and which are more aware to the various exposures of our environment. So I wouldn't concentrate in the beginning so much on producing impressive, maybe for newspaper headlines information, did you know that you run a risk of whatever, but design with urban planners and with others, communities which are safer.
Yes, hi there. David Conti from USC. So one of the results of the Human Genome Project was sort of the redefining of population using sort of genetic ancestry or genetic similarity. Right now, geneticists are really pushing towards this continuum of population descriptors. On the other extreme, you have sociologists who sort of describe these things as lived experiences. So I'm just wondering what your thoughts are on sort of how the exposome can be used to define populations.
Any of the panelists want to jump in with the?
Speaking as an ethicist, I know that the exposome researchers are working on ideas of expotypes. And I think that this is analogous to the idea of a haplotype. I know that this is perhaps one of the ways in which stratification could happen. But this seems more of a question perhaps to another panel. But I think it's good as a matter of philosophy of science to recognize the different investigative aims that we have and subsequently the different investigative concepts that we use. So if we're trying to investigate human health, then we're looking at different cross-sections of populations than, for instance, when we're interested in tracking a person where he's been because of an issue of criminal justice, for instance. So an expotype that would be informative for where someone been asked to serve criminal justice might be different than the concept that we might need to investigate people's health, for instance. And the same can be said of sociologists who have different investigative aims, looking at different sometimes they call them classes, sometimes they call them cleavages in populations in order to serve some investigative aim. So we should be sensitive to that issue as well.
That's great. And we're dangerously close to lunch, and I know people get aggressive when they're hungry. And I think tomorrow maybe we can explore a bit more so the personalized level of exposure, which is something that, for example, I'm more interested in working around the population. But we shall do that with certain target. Michelle is looking at me saying, "Get off. We are off. We're done." Thank you very much. Thank you.